Hey guys, I'm Jacob Carlson, one of the plastic surgeons here at North Texas Plastic Surgery. Today we're going to be answering the questions that you guys submitted, so let's get started. Fat necrosis is somewhat of a difficult topic to address. It is an instance in where the fat in a particular area has lost its blood supply, it's not able to survive, so then it essentially dies. And what can happen in that area is that it becomes hardened and calcified. And that's very frustrating because it's not necessarily something you did, not something that the surgeon did. It just happens because the blood supply to that particular area was lost. The best way to treat it, and more times than not, the only way to treat it in some cases, is actually excising it or cutting it out. If it's caught early on, if you feel an area that feels a little bit more firm, then you can do some types of massage. And depending on where the area is, if my patients notice that one area feels a little bit more firm than the other after surgery, I'll have them use like a Theragun or a massage gun in those areas to help break up the tissue. That will help soften it sometimes. Obviously, right after surgery is not the time that you want to do that. You're going to be very tender just from the surgery itself, so then using something that's constantly beating on an area is not really going to be appropriate. Depending on the location, that also might not be appropriate. If it's something that you feel on the chest after a, say, mastopexy, just doing massage with your hand is probably going to be more appropriate than using a massage gun. That being said, unfortunately, in a lot of instances, if you are, a few months to years after surgery and you feel a hard, palpable lump, the best way to treat it is going to be likely excising it. So with a BBL, the way that is done is we obviously take fat from somewhere in the body and then inject it into the tissue above the gluteal muscles of the buttock area. In order to do that, we have to make an incision somewhere, place a cannula, and then inject the fat. You don't want to do ovally too soon after that procedure because of a few things. Obviously, there's going to be swelling from injecting the fat and doing the dissection with the liposuction cannula. Secondly, we want to know how much the fat is going to take before we do any type of procedure that's going to manipulate the tissue in that area. I would say the safe answer is going to be, at minimum, I would wait a year. And the reason that I say that is that allows the fat to reestablish its blood supply. You know how much of it is going to survive compared to atrophying or going away. You've kind of had the chance to go through what people will call the fluff period, and you've allowed the scar tissue that's going to form from the liposuction tracts as well as the bands that are causing any type of septa leading to cellulite to establish themselves and be present. So I would say a safe answer is about a year. So an upper Blvd, again, has probably the easiest recovery of any of the procedures that we do. If you have a significant event coming up, I would recommend doing the procedure, doing the upper blepharoplasty at least a month beforehand. That allows for swelling and bruising to go away. A lot of the appreciable swelling will have gone away in that first month. That being said, it might not be at its final stage at that point, but at least gives us some time to see how much swelling is present. If there's anything that we need to do, make sure that there's not any complications from the surgery. Again, most of the swelling and bruising should be gone by about a month after surgery. Additionally, a lot of patients will ask me when they can wear makeup after a blepharoplasty. I would recommend waiting about 3 weeks before trying to apply anything there. Part of that is just making sure the incisions are healed, making sure that the inflammation is starting to subside before you manipulate this area. It's usually about the 3-week mark where I'll have patients start doing some scar massage and or lymphatic massage in this area to help reduce the swelling. So I think the safe answer is about 3 weeks. Thank you guys very much for submitting the questions. This was a lot of fun. If you guys have any more questions, please don't hesitate to leave those below. Don't forget to like, comment, and subscribe. And obviously, if you have any other questions about any of our other videos, don't hesitate to reach out on there as well. So again, thank you guys so much.